Hi, my name is Dave Feeley with Oxford Physical Therapy. I'm the manager of our Florence Center location and our Chancellor Drive location located on Thomas More. As many of you have heard today, Serena Williams is pulled out of her comeback to the Grand Slams due to a pec injury. Her primary complaint with the pec injury, although it's unspecified, she's going to have an MRI done later today, is that she was having pain in her shoulder and unable to complete her serve. The pec muscles are one of two muscles, the pec major and the pec minor, that originate at the medial half of the clavicle and into the costal cartilages of the first 6 ribs, and then attach at the lateral humerus. Their activity is to help to flex, adduct, and medially rotate the shoulder, which is very important in the follow-through of the serve. Her major complaint is that she was unable to complete a serve motion to 60% of her ability, and combined with her team, she stated that she would not compete if she was unable to do that. Some things that you can do prior to activity to help warm up your shoulder to help prevent one of these strains is to warm up your rotator cuff muscles as well as a pec stretch. And there's a few different ways you can stretch your pec. A real easy way is a doorway stretch. Done over here, you can put your arm up your shoulder, abducted to about 90 degrees and flexed to about 90 degrees, and then your elbow flexed to about 90 degrees, and then slightly lean into the doorway to stretch your pec. 2 other ways that you can help hit some of the pec minor heads are to elevate to about 115 degrees of shoulder abduction, and then depressing down to about 45 degrees of shoulder abduction as well to help to stretch those muscles. So make sure you warm up well prior to doing any overhead athletic sports to help prevent these injuries.
Awesome. We have a couple questions that might be asked if a patient comes in for therapy for this type of injury. You answered a couple of them. How long will someone be out of the game with this type of injury, or how long will they need therapy if they came in with this type of injury?
Most soft tissue injuries take around 6 to 8 weeks to heal. With rehab, that process can be sped up depending on the athletic ability of the athlete.
Okay. If a doctor is requesting surgery, should they still go to therapy before or after?
It depends on the variability of the injury. If it's a strain, physical therapy is going to be one of your best options. If there's a complete tear of the pec muscle, you're oftentimes going to see widespread bruising throughout the shoulder and into the pec area or breast area, in which case potentially you need reattachment for that purpose.
Okay. There are a couple people watching right now. If you guys do have any questions, right now would be the time to ask Dave while we have his attention. But if not, thank you, Dave, for doing this. And I hope everybody has a safe athletic experience. Thanks, Dave.
Thank you.